Knock, knock. Hi, I'm Catherine. I'm going to be your student nurse for today. Can you tell me your name and date of birth, please?
Orlando Anderson, January 2nd, 1997. How are you?
Good, how are you?
Swell, thank you.
Okay, awesome. Can I have you remove your hood for me, please? Do you know why you're here today?
Yeah, I think I have some staph infection.
Okay, yeah, so we'll get to that after, but you're here for your yearly cardiac and vessel assessment.
Okay.
So, I'm going to begin by taking a look at your hands, please. Can I see both of them? Okay, so I'm just going to look at capillary refill. So capillary refill less than 3 seconds bilaterally, warm and well perfused, and skin color consistent with ethnicity and the rest of his body. And so the next thing I'm going to take a look at is, so I'd raise the head of the bed 30 degrees and remove the pillow. So I'm going to be taking a look at your pericardium, and I'm going to inspect the way you breathe and the way your heart goes. So I'm just going to take a feeling. Okay, and so there's no palpitations and no heaves or lifts observed, no thrill or other pulsations felt upon palpation. So now I'm going to take a look at the jugular venous pulse, and that is, I'm going to be looking at your neck. So can you just sit up for me? So I'll look at the sternocleidomastoid, and then I'll go to the left of that, and I'd palpate. It's okay, you can relax.
Don't hurt me.
Okay. Yeah, so I'll do it bilaterally. You can just relax and look forward. Thank you. The sternocleidomastoid. Okay, so I feel really light pulse in the jugular. And so observe mild internal and external jugular vein pulsation bilaterally. So now I'm going to listen to his heart sounds, and I'm going to be listening for a clear S1 and S2. And so I'm going to go to Erb's point. I'll just do it over your clothes, okay? So Erb's point. So this. Okay, clear one, S1 and S2 at the apex of the heart, and then I'm going to go down. I'm going to listen directly above the heart. Okay, second, intercostal, third, fourth, fifth. Okay, clear S1 and S2 directly over the heart. And so that's with the diaphragm, and now I can listen with the bell. Okay. So S1, S2 crisp, non-diminished or accented, regular rate and rhythm, and no murmur or extra heart sounds. So now I'm going to listen to the carotid arteries and palpate, but I'm not going to do both at the same time because that would cut off blood flow to his head. So I'm going to start by feeling the sternocleidomastoid and then palpating his carotid arteries. Okay, the other side. And so these are going to be 2+ bilaterally, and I'm going to listen to them now. Or sorry, 1+ bilaterally, not 2+. And so what I'm going to be listening for is like a murmur and like blood flow being displaced. And I'm going to be using the bell of my stethoscope. Okay, and the other side. All right, it's a little bit fainter, but osculated carotid arteries bilaterally and no presence of bruit or murmur, and then they're 1+ bilaterally. And so now I'm going to listen to his heart sounds a second time, and I'm gonna ask him to lean forward, and then I'm gonna use the 4 landmarks APET. So if you could sit up for me, please. And then lean forward a bit. So I'm gonna listen to it again using my diaphragm. Okay. And I'm using the 4 landmarks during this. Okay, and we're still having a really clear S1 and S2, and then regular rate and rhythm, and no murmur or extra heart sounds. You can relax, lean back. And so now for the last thing I'm gonna do is palpate the aorta. And so to do this, I just feel like the midline on the abdomen. And so this is gonna actually be above your belly button because your aorta runs down from your heart. So and then you have to go down like 1 or 2 inches. Actually, can I have you like lay down? Thank you. Okay, so I'm gonna go midline and I'm just gonna palpate. And then do you feel any tenderness or pain when I palpate right here?
Right there? No.
No. Okay, that's good. You don't want to feel that. All right, so you're all clear. We'll take a look at the other thing you mentioned earlier, but thank you for participating in the physical exam of your cardiac and neck vessels.
Thank you.
All right, have a good day.